Hi, my name is Alexandra Dubinskaya, and I'm a female pelvic medicine and reconstructive surgeon. I would like to talk about the female sexual response cycle. It includes 4 different stages: desire, arousal, orgasm, and resolution. Beginning with desire. Desire is a motivation to engage in sexual activity. Desire can be spontaneous, as an internal arousal or desire to connect with a partner. Desire can also be responsive, as in response to a partner's advances. Responsive desire is very common among women. Women's desire is structurally complex and it's dependent on the settings, emotional closeness, and other factors that not often sexual in nature. Furthermore, a woman's level of desire might fluctuate throughout life. Different biological and social factors affect desire. Biological factors might include hormonal changes during menopause, during menstrual cycle, illness, or certain medications. Some of the social factors include sleep deprivation, work-related stress, financial or relationship difficulties. Desire often comes back with rest, vacation, or discontinuation of certain medications. Some women might have a condition called hypoactive sexual desire disorder. This means they have a chemical disbalance characterized by the decreased activity in the brain areas responsible for desire and arousal. These women are not able to have a spontaneous desire, nor responsive to their partner's advances. This can cause personal and relationship frustration and distress. Fortunately, there are 2 medications, flibanserin and bremelanotide, have been developed that help reverse the disbalance and cure hypoactive sexual desire disorder in premenopausal women. Unfortunately, this medication have yet to be approved by FDA for use among postmenopausal women. For this same population of women, a different medication, testosterone, showed moderate therapeutic benefit. Arousal, the next stage, is a physiologic response that occurs as a result of sexual stimulation or activity. Many sources cause sexual stimuli in women: smell, vision, taste, tactile stimuli, and mental imaging and fantasies. All the stimuli are registered in the brain and trigger the response. Almost every system is involved in arousal response. Increase of heart rate, breathing, body temperature, and vaginal lubrication. Ideally, it takes a good health to generate arousal. However, urologists and gynecologists frequently encounter women with the issue of vaginal dryness. The vagina usually has an abundant blood supply that increases during sexual stimulation and arousal. Increase in blood flow forces plasma from the bloodstream to pass through the vaginal wall, creating a transudate or vaginal lubrication. It may take some time for this process to occur. Some young and healthy women may need to use a lubricant during sex, which is completely normal. Decrease in estrogen during menopause, breastfeeding, or while on contraception pills affect the blood flow to the vagina. It results in less lubrication produced by the body. Topical vaginal estrogen is the best treatment for this condition. Although topical estrogen therapy was shown to be safe, some women prefer to use non-hormonal personal lubricants. Another condition I might add is persistent genital arousal disorder. It's a rare and complex condition that's characterized by the persistent sense of being aroused without any sexual stimuli or stimulation being present. This condition happens due to pathology in any of the regions, including clitoris, pelvis, cauda-equina, spinal cord, or brain. Treatments usually based on their region of pathology. Orgasm is the peak of the sexual response cycle and is characterized by involuntary vaginal wall, uterine, and pelvic floor contractions, genital vasocongestion, and general state of euphoria. Traditionally, we think about the 2 regions of orgasm, clitoral and vaginal. Majority of women orgasm from clitoral stimulation. The clitoris is similar to a penis as it originates from the same tissue. The clitoris is larger than one might expect, but it's mostly hidden and it's highly innervated and sensitive to touch. While some women achieve orgasm from vaginal penetration, is often due to stimulation of the deeper parts of the clitoris. Some women have never experienced an orgasm, whether the partner or self-stimulation. This is where education on anatomy, sex education, and sex enhancement tools like vibrators might be found helpful. Women who are able to orgasm may lose the ability to orgasm or have a decrease in quality of orgasm as a result of biological or social factors, like changing health conditions or new medication, clitoral pathology, and relationship or work-related stress. The resolution phase is where the body slowly returns to its normal level of functioning after an orgasm. Interesting fact about this stage. In males, it's called the refractory stage, and they are usually incapable of further sexual arousal after having an orgasm. Women, on the other hand, have no such refractory period and can quickly become aroused again from any point during the resolution stage. While female sexuality can be complex, pathology in sexual response cycle can be addressed and treated. Dissatisfaction in sex life can lead to depression, anxiety, and overall low quality of life. It's very important to bring up your sexual concerns with your medical provider.